Have you ever noticed a sudden swelling or unusual warmth in one leg and brushed it off as just fatigue or a long day of standing? What if I told you that ignoring that sensation could be quietly putting you at risk of a life-threatening condition?
Deep vein thrombosis, or DVT, is a blood clot that forms in the deep veins of your legs. What makes it so dangerous is not just the clot itself, but what can happen if it travels to your lungs, a pulmonary embolism, which can be fatal. Here's the unsettling fact. Studies show that DVT affects hundreds of thousands of people each year in the United States alone, and many never recognize the warning signs until it's too late. Yet the good news is that by understanding the body's subtle signals, you can dramatically reduce your risk. Let's pause for a moment and consider what's happening inside your body. Blood is designed to flow freely, delivering oxygen and nutrients while removing waste. But when circulation slows, whether due to prolonged sitting, certain medications, or underlying health conditions, the risk of clot formation rises. From a neuroscience perspective, this is your brain-body system's way of signaling imbalance. You may feel heaviness, tenderness, or even an unexplainable sense of fatigue in your leg. These are not just random annoyances. They're messages your body is sending. The stakes are clear. Your ability to maintain health, mobility, and long-term vitality depends on recognizing and responding to these signals. And this isn't just theory. Decades of vascular research and clinical studies have mapped out the most reliable signs of DVT and, importantly, how to intervene early. In this video, I'll guide you through the top 7 signs and symptoms of leg blood clots, translating complex medical science into practical, actionable insights you can use in your daily life. You'll learn how to detect warning signals early, which behaviors put you at higher risk, and simple but powerful habits to prevent clots from forming in the first place. By the end of this session, you'll walk away not only with knowledge, but with a toolkit to proactively protect your circulation and overall health. So let's dive in, step by step, and equip your body and mind to respond before it's too late. Have you ever noticed that one leg feels slightly fuller, almost tight at the end of the day, and wondered if it's just fatigue from standing or sitting too long? What's easy to dismiss as mundane can sometimes be the earliest whisper of a deep vein clot forming in your leg. Unexplained swelling in one leg is often the first and most telling sign of DVT. Here's what the research shows. The Journal of Vascular Surgery found that unilateral swelling, meaning it affects only one leg, is a strong indicator of a clot in the deep veins. The reason is straightforward. Your veins are highways for blood returning to your heart. When a clot partially or fully blocks this flow, pressure builds behind it, causing fluid to leak into surrounding tissues. That's the swelling you feel. It's subtle at first, sometimes just a half-inch difference in calf circumference, but your body is signaling that circulation is impaired. A simple tool to apply is a daily leg check. Take a tape measure or even just observe your legs in a mirror. Note differences in size, especially after prolonged periods of sitting, long flights, or car rides. Small, consistent measurements allow you to detect changes early, before the swelling becomes painful or more pronounced. Another practical approach is to engage in intermittent movement. Standing up every 45 to 60 minutes, walking or doing gentle calf raises stimulates venous return, essentially flushing the blood back toward your heart and reducing the risk of clot formation. Think about your veins like a crowded highway. If traffic slows in one lane due to a blockage, cars, or in this case blood, start backing up, creating congestion that spills over into surrounding areas. Your calf or ankle begins to swell, a natural response to that traffic jam. By maintaining movement and observing subtle changes, you're essentially giving yourself a traffic update, knowing exactly when to intervene. Have you noticed how people often ignore mild swelling until it's painful or obvious? That delay can be costly. Early recognition and proactive habits make a significant difference. Even something as simple as wearing compression socks during flights, elevating your legs when resting, or incorporating short walking intervals can dramatically reduce risk. If this insight is helping you, consider subscribing. There's more science-backed guidance coming that can empower you to manage circulation, prevent clots, and improve overall vascular health. Recognizing swelling is the first step, but the actionable habits you implement immediately afterward are what truly protect your health. Have you ever experienced a dull ache or tenderness in your calf or thigh and shrugged it off as muscle fatigue? Most of us do, especially after a long walk, workout, or standing for hours. But persistent, unexplained pain in one leg, especially when it's localized, can be a subtle but critical signal of a deep vein clot forming. Here's what the research shows. Studies published in Circulation highlight that DVT often causes a distinctive type of tenderness. Unlike typical muscle soreness that eases with stretching or rest, clot-related tenderness may feel deep, almost internal, and sometimes worsens when pressure is applied or when you flex your foot upward, a movement clinicians call the Homans sign. It's not always dramatic pain, which is why it's so easy to dismiss, but your body is clearly sending a warning signal. Think about it like a pressure sensor in your leg. When a clot forms, it irritates the walls of the vein and surrounding tissues, creating localized inflammation. Your brain perceives this as a deep ache, a signal that blood flow is compromised. The good news is that by learning to distinguish normal fatigue from abnormal tenderness, you can intervene early. A simple tool to apply is a daily awareness check. Gently press along your calf and thigh, paying attention to asymmetry between legs or unusual soreness that doesn't match your activity level. Combine this with movement. Routines. Calf raises, ankle rotations, or walking short distances can improve circulation and reduce stagnation. You're essentially giving your veins a gentle push to keep blood moving efficiently. Here's a practical framework. If tenderness is persistent for more than a day or two, or is accompanied by swelling, warmth, or redness, it's time to seek medical evaluation immediately. Don't wait for it to go away. Early detection saves lives. Have you noticed how subtle pain is often ignored until it becomes severe? By tuning in now, you're building a habit of physiological literacy, the skill of understanding what your body is really telling you. This awareness doesn't just prevent clots, it enhances your overall performance and resilience. If this insight is helping you, take a moment to like this video and subscribe. Each new habit you adopt strengthens your ability to respond proactively, rather than reactively, to your body's signals. Persistent leg pain is not just discomfort. It's a cue to act. Have you ever noticed one leg feeling unusually warm or looking slightly red compared to the other? Many people dismiss these subtle changes as irritation from clothing, sun exposure, or even mild infections. But when warmth or discoloration appears in one leg without a clear cause, it can be an early warning sign of a deep vein clot. Here's what the research shows. A 2019 study in thrombosis research found that localized inflammation from a clot can trigger both warmth and a reddish or bluish hue in the skin. This occurs because the body's immune response detects the clot as a problem, sending extra blood flow and immune cells to the area. It's similar to how your skin turns red around a small cut. Your body is alerting you to something abnormal. Think of it like a subtle traffic light in your body. While swelling is the congestion, warmth and color change are the flashing yellow lights, signaling caution. Ignoring these signals is common, especially if the discomfort isn't severe. But your body is communicating that venous flow is compromised and action is necessary. A practical tool you can use is mindful observation. Regularly check your legs for differences in temperature and coloration, especially after periods of inactivity, long flights, or extended sitting. Pair this with simple circulation-promoting habits. Gentle leg lifts, calf stretches, or even a 5-minute walk every hour can help keep blood moving and reduce stasis. Here's another actionable tip. Elevate your legs for 10 to 15 minutes after prolonged sitting. Gravity assists venous return, easing pressure in blocked veins. Combine this with hydration, because blood that is more viscous or thick increases clot risk. Staying properly hydrated supports smooth blood flow and lowers the likelihood of stagnation. Have
You noticed how subtle visual or tactile cues from your body are often overlooked? By cultivating awareness of these early warning signs, you're training your brain to notice patterns before they escalate, a principle backed by behavioral
science. Small, consistent observation paired with preventive action is your most powerful tool. If this insight is helping you, pause for a moment to like this video and subscribe. There's a lot more science-based guidance coming that can help you proactively protect your health and circulation. Remember, warmth and color changes aren't random. They're signals demanding your attention. Have you ever noticed veins in your leg becoming more pronounced or twisted, almost as if they're trying to announce themselves? While some vein prominence is normal, sudden or asymmetric changes in one leg can signal something more serious. A blood clot obstructing deeper veins and forcing superficial veins to compensate. Here's what the research shows. The American Heart Association notes that superficial veins can become engorged when deep veins are blocked. Blood has to find alternative pathways, and your visible veins are often the highways that suddenly bear more traffic. This is not just a cosmetic concern. It's a warning that circulation is compromised. Think of it like a river. If the main channel is dammed, smaller tributaries flood. Your body's veins are showing the overflow, signaling a blockage below the surface. Ignoring these visual cues can delay intervention, increasing the risk of complications. A simple, actionable tool is routine visual inspection. Use a mirror, or have someone help check your legs periodically. Look for veins that appear swollen, bulging, or darker than usual. Combine this with movement-based habits to support circulation. Calf raises, ankle rotations, and short walks every hour can help redistribute blood and reduce pressure in these superficial pathways. Another practical approach is wearing medical-grade compression socks during long periods of inactivity, flights, or desk work. Research shows that compression helps maintain venous pressure and promotes smoother blood flow, reducing strain on both superficial and deep veins. Have you noticed how subtle vein changes are often dismissed as just varicose veins? While varicose veins develop over time, sudden or asymmetric changes, especially with swelling or tenderness, are a red flag for DVT. Your attention to these details can be life-saving. If this insight is helping you, consider pausing to like the video and subscribe. Each small habit you implement, from visual inspection to strategic movement, empowers you to respond to your body's signals proactively rather than reactively. Visible vein changes are not just superficial. They are your body sending a clear signal. Act now. Have you ever felt that one leg suddenly feels heavy, almost like it's carrying extra weight, even when you haven't been unusually active? Most people chalk this up to tired muscles or a long day of standing, but persistent or unexplained, leg heaviness can be a subtle signal that blood flow in your deep veins is being obstructed, a hallmark of a forming clot. Here's what the research shows. A study in the European Journal of Vascular and Endovascular Surgery found that impaired venous return increases the workload on your muscles. When blood pools in your leg, your calf and thigh muscles must work harder to push it back to the heart, which your brain interprets as fatigue or heaviness. This sensation is often one of the earliest subjective warning signs of deep vein thrombosis. Think of it like a backpack that gradually fills with water. You might not notice at first, but as it grows heavier, movement becomes labored. Your leg muscles are essentially carrying that extra weight because circulation is slowed. Recognizing this feeling early is key. It's your body asking for intervention. A simple behavioral tool is to practice conscious leg mobility throughout the day. Standing up, walking, or performing seated calf raises every 45 to 60 minutes can actively pump blood back toward your heart. Another practical strategy is leg elevation. Raising your legs for a few minutes while seated or lying down helps relieve pooled blood and reduces the sensation of heaviness. Have you noticed how people often ignore persistent leg fatigue, attributing it to stress or exercise? By tuning into your body's signals, you create a habit of physiological awareness. which is one of the most effective preventive strategies against clots. Even small interventions, done consistently, drastically improve circulation and reduce risk. If this insight is helping you, pause to like and subscribe. Each habit you adopt strengthens your ability to notice and respond to your body proactively. Remember, leg heaviness isn't just fatigue, it's a message, and responding promptly can prevent serious complications. Imagine feeling a sudden, unexplained shortness of breath or a tightness in your chest. It can be alarming, and for good reason. In some cases, these symptoms are not just random. They can signal that a blood clot from your leg has traveled to your lungs, a pulmonary embolism. This is a medical emergency and one of the most serious complications of deep vein thrombosis. Here's what the research shows. A 2015 study in the New England Journal of Medicine emphasizes that clots dislodging from deep veins can block blood flow in the pulmonary arteries, reducing oxygen delivery to the body. The result is sudden shortness of breath, chest pain, or even rapid heart rate. While not every clot leads to a pulmonary embolism, recognizing these early systemic signs is crucial. Think of your circulatory system like a series of interconnected highways. A blockage in one area can cascade downstream, causing a traffic jam in critical areas. Your lungs are particularly sensitive to this disruption because they're the hub for oxygen exchange. Sudden respiratory or chest symptoms are the body's urgent way of signaling a serious obstruction. A practical behavioral tool is awareness and immediate action. If these symptoms occur, seek medical attention without delay. Do not wait to see if it passes. Early intervention can be life-saving. In addition, preventive strategies like staying active, avoiding prolonged immobility, maintaining hydration, and using compression during long travel are essential ways to reduce the likelihood of clots forming in the first place. Have you noticed how easy it is to overlook minor signs until they escalate? By cultivating awareness of both local leg symptoms and potential systemic warning signals, you're training your brain to detect danger early. This is not just a precaution, it's a habit that directly impacts your longevity and resilience. If this insight is helping you, consider liking this video and subscribing. Understanding and responding to sudden shortness of breath or chest discomfort can literally save your life. Remember, these are not minor symptoms. They are urgent signals that demand immediate attention. Have you ever noticed that your leg cramps more frequently or feels unusually sensitive to temperature, warmer or colder than normal, even when there's no clear reason? While occasional cramps are common, a sudden change in cramping patterns or thermal sensitivity in one leg can be an early signal of impaired circulation due to a developing blood clot. Here's what the research shows. A 2018 study in the Journal of Thrombosis and Hemostasis found that clots can induce localized inflammation, which in turn affects nerve signaling and muscle function. This can manifest as more frequent cramping or a heightened awareness of temperature differences in the affected leg. Essentially, your muscles are sending feedback that something in the underlying circulation isn't right. Think of it like an electrical circuit experiencing a partial blockage. Signals still travel, but irregularly. Muscles tighten, nerves respond differently, and sensations of heat or cold can be exaggerated. Recognizing these subtle cues is key, because early detection allows for intervention before more serious complications arise. A practical behavioral tool is integrating daily mobility and stretching routines. Gentle calf stretches, ankle rotations, and short walks can reduce cramp frequency by promoting blood flow. Another approach is to maintain hydration and adequate electrolyte balance, as thickened blood and mineral imbalances can worsen both cramping and clot risk. Compression socks can also help maintain venous pressure and reduce local stress on the veins. Have you noticed how often we ignore mild discomfort until it escalates? By tuning in to these subtle signals, you are training yourself to respond proactively rather than reactively. Small, consistent habits like movement breaks, stretching, and hydration can significantly reduce clot risk and support long-term vascular health. If this insight is helping you, pause to like and subscribe. Your engagement not only supports this channel but reinforces your own commitment to proactive health. Temperature sensitivity and leg cramping aren't just nuisances, they are early warning signals. By paying attention and taking action, you empower yourself to maintain circulation, mobility, and overall vitality. We've covered a lot of ground today, so let's bring it all together. Deep vein thrombosis is often called a silent threat because its earliest signals can be subtle, easy to dismiss as fatigue, soreness, or just the normal wear and tear of daily life.
But as we've explored, your body is constantly communicating with you, sending clear messages if you know how to interpret them. The 7 key signs to watch for are unexplained swelling in one leg, persistent leg pain or tenderness, warmth,
or skin discoloration, visible vein changes, leg fatigue or heaviness, sudden shortness of breath or chest discomfort, a serious, urgent warning, temperature sensitivity and leg cramping. Each of these signs is backed by decades of vascular and neurological research, and together they create a powerful framework for awareness. But awareness alone isn't enough. What truly protects your health is action. Small, consistent habits that maintain circulation, reduce stagnation, and keep your vascular system functioning at its best. Here are the tools we highlighted. Daily leg checks for swelling or vein changes, mindful observation of warmth or skin color, hydration and movement breaks every 45 to 60 minutes, stretching and calf raises to support venous return, leg elevation after prolonged sitting, and compression socks during travel or extended immobility. And most importantly, immediate medical attention if you notice sudden shortness of breath, chest pain, or rapid heart rate. That step can save your life. Why does this matter beyond clot prevention? Because cultivating this level of body awareness builds what psychologists call interoceptive intelligence, the ability to tune in to subtle signals from within. Research in neuroscience shows that this awareness not only improves physical health, but also enhances emotional regulation, decision-making, and overall resilience. When you learn to listen and respond to your body's signals, you gain an edge in every area of life, from performance to longevity. So here's my challenge to you. Starting today, pick one tool and implement it. Maybe it's setting a timer to stand and move every hour, or wearing compression socks on your next long trip. Maybe it's simply paying closer attention to how your legs feel at the end of the day. Choose one and build from there. Small steps, repeated consistently, create lasting protection and vitality. If today's session gave you value, I invite you to like this video, subscribe to the channel, and share it with someone you care about. This isn't just about preventing blood clots. It's about building a community committed to proactive, science-driven health. Together, we can translate the latest research into practical tools that extend not just the length, but the quality of our lives. Your body is talking. The question is, are you listening?